Good morning or afternoon. This is Russell Hendrickson with PDS. Thank you for joining us for today's webinar. Today's topic is patient access analytics and dashboarding, identifying performance gaps. Visualization has become synonymous with analytics, and very few organizations that I speak with today not focused on visualization as a topic around analytics. And in just a few hours, we were able to build out, very powerful visualization. In this case, we're using Ursa Maps by a tool from MicroStrategy, where you could very point and click. We took a patient appointment scheduling data, loaded it through the tri-state area of the Northeast, where we're located, and at a touch of a button, I can point and click and start to see whether they're the counties that the patients that we're seeing are coming from, or I can even highlight within an area and zoom right in and start to see where the bulk of our patients are coming from within a particular region or area. We were able to do this in just a couple hours, which really highlights the power of visualization tools. But beyond some of the glitz and the tools, we really need to dig into what's important. And today's topic, we're going to focus in on patient access. And how do we start to visualize some of that data? On the other side, we built out this visualization. It took more than a couple hours. In about a week or two, we were able to build out, a graphical visualization that could be delivered to end users that shows things like appointment lag category and third next available, and starts to correlate a number of metrics across the screen, making it very easy for users. But to get to something as complex as this, it's not about the tool, it's not about the analytics, it's about having the right metrics, understanding where we focus them, and understanding our organization challenges as we move forward. So with that, I'd like to introduce Scott Everitt, who's going to lead us through today's topic. Scott is the Vice President of Analytics Solutions here at PDS, and he brings over 18 years of healthcare experience to today's topic. So with that, Scott.
Thanks, Russ. I appreciate the opportunity to speak to you today. It's kind of funny. I was talking to a colleague the other day who mentioned how many services and education opportunities that are out there regarding patient access, and how large a topic it's really become in the industry. And it's really not difficult to see why. Patient access is not only a critical part of the revenue cycle. I think there is an argument to be made. It may be the most important part of the revenue cycle. And the old adage goes, you never get a second chance to make a first impression. And the patient access is really what sets the tone regarding the patient experience and what they perceive your organization to be. At the end of the day, they may receive excellent care. They may have the optimum outcome from what they've received, but if they had a poor experience with the access team or with the difficulty getting an appointment scheduled, anything like that, then it can really kind of taint the perception that they have of your organization. So with that in mind, we want to talk a little bit about what we're going to do, and the goals we have for this webinar today is we really want to understand the challenges that are out there. And I know everybody's is a little bit different, but we want to know how we can utilize analytics, reporting, dashboarding to highlight gaps that are out there, and maybe discuss some strategies for managing the change required in order to really help drive this patient experience regarding access. Now, before we begin and dig in, I'd like to have you take a little bit of survey so that I can kind of gauge the audience. And this is around, what you struggle with regard to identifying these performance gaps.
And the question that we're asking everybody in the audience is, which area of patient access do you have the most difficulty measuring performance gaps?
This is interesting that there's a lot of who are having some difficulty with provider scheduling and schedule utilization, which is certainly something that we see and hear from a lot of our clients as well, and something that we can work with them on. And then denials and resolutions of those denials with regard to authorization and insurance verification seem to be the largest ones that we're seeing out there. So certainly things that we've heard a lot of, and something that is definitely pertinent to what we're going to discuss today. So I appreciate your input on this. I want to take a second and just get real with you for a minute. The days of, well, he's my doctor, are going away. In a recent political poll that was taken, the loyalty to provider is something that just over half of the people said is something that they take into consideration when they're choosing where they receive their care. Of far more importance to the people who were taking this poll were how quickly they could get in and what the overall costs were going to be. And as you look at the changing landscape of healthcare, you can see definitely that's going on. Why is it that they'll go someplace faster because there's a plethora of competitive availability out there with quick access to healthcare, from urgent care centers to retail centers and all things in between. The market certainly is becoming more and more competitive for the business of patients that are out there. And it's not just patients, but it's referring physicians as well who want to be able to get their patients in quickly because they're not going to want to deal with the dissatisfaction of their patients having to wait to see specialists. And even if you don't want to take those into account, patient access, or more importantly, perception of patient access, is something that payers are utilizing in quality-based contracts now. So it's something that if you don't manage well, it's going to impact how you get reimbursed from your payers. Well, as we look at it, we can see, what are the things that we're hearing from patients out in the market at this time. We hear from patients, their premiums are going up and up and up, and that's just, the way of the world right now. But in addition to that going up, they're having to open up their wallets and take a greater responsibility for the care that they're receiving in the clinic, whether it's a high deductible care plan, whether it's more co-insurance. It's something that they're having to take more financial responsibility for. Because of this, they're going to have more demands on, what they're receiving from the people who deliver care. So they want appointment times that are going to be more convenient for their schedule. They are going to want to not have to deal with surprise bills from areas that they're not expecting, and they're going to want to make sure that the doctor's office is doing everything in their power to make sure that all of their demographic information is best and that they're billing the correct insurance at the time.
Scott, my mother, God bless, is 82 years old. The two biggest complaints I hear sort of regularly is how long does it take to see a specialist, why they can't get her in, why she has to call back to her primary care physician to try to force her to get into the specialist ahead of time. And then, of course, the second thing is, I gave them all my insurance information. How come I'm still getting calls or bills or information that's missing?
Yeah, and I appreciate those, specific experiences, Russ, because that really indicates, the need that's out there and what our patients are seeing. And if you really want to break this down, what the patients want is fairly simple. It's just what's our ability to be able to deliver to this. And of course, what they want is they want to be able to get in quickly. They want to not feel like they're waiting forever and worried that they're going to get sicker and sicker before they can get in to see a doctor. And they want it to be at times that don't require them to juggle their schedule a ton. They want it at convenient times for them. Obviously, the outcomes are important to them, but they also don't like surprises. They don't want to have a bunch of bills coming that they weren't expecting. They want you to be transparent with them, to not feel like you're hiding anything from them, and they want you to communicate with them effectively. And that may mean different things for different people. Some may prefer communication over the phone. Others may prefer emails or text. What they want is to make sure that they're being listened to, they're being heard, and that they're being communicated effectively with their physician's office so that they know exactly what they're responsible for so that they can plan around that. Well, I think the problem that we have is a lot of times organizations themselves aren't getting this feedback from their patients directly. So how can they find that? And obviously it comes from looking really in-depth at patient satisfaction scores. And once you see that, then you can really start to determine what are the drivers of your patient experience. What is it that they're satisfied with? What is it that they're dissatisfied with? Is it your physicians that are driving their satisfaction or dissatisfaction, or is it the employees that they're interacting with? Is it that they can't get an appointment, or they can get an appointment, but they feel like they're just being crammed in with a bunch of other people and can't get out of the waiting room once they do? There's a lot of things that drive this patient perception that's out there, and the best way to reconcile what's really going on with what the patients are seeing is by really looking at this frequently and providing timely feedback to staff, employees, and management regarding patient satisfaction. Well, again, there are some challenges that arise in what we're doing, where we look at it and say, we're doing everything we can, but our patient satisfaction scores just aren't reflecting on our efforts. What's going on there? Or we don't know what changes specifically we need to make in order to get to that. We have referring physicians that are giving us, indicating that they're dissatisfied. And even with all of the initiatives we put into place, and even with all of the changes that we're trying to make, we're still not collecting patient balances effectively, and we're still getting a ton of denials for insurance eligibility and pre-authorization, and what is it that we can do? It's a lot to manage.
So Scott, what I'm gathering really is patient access is really the key to the patient experience, and we need to look outside of, getting an appointment or how long it takes to get in front of the physician to really understand what's going on with our patient access and how it relates. So you shared a number of challenges there. Can you break that down? Because from a technical perspective, I can't begin to surmise what a dashboard or analytics would look like without more specifics about the kind of KPIs and metrics that you're going to want to see.
Sure, Russ. Every organization is going to be a little bit different with regard to where their gaps are, what they're doing well, and where they're struggling. But really, in the end, they know at a high level where those areas are. One of the things that's really going to be critical in terms of how successful they are with what they're trying to do in patient access is to set some goals utilizing some accurately calculated and valid and reliable metrics, even if it's just a handful of them, and making sure that they're taking a look at these on a very timely basis and that they're communicating those out. Where it becomes a little bit more difficult is they need to blend data, because this is all coming from different areas. It may be coming from the billing system, the scheduling system, or even a third-party patient satisfaction survey system in order to get these, and how can they put all of this together? The fact of the matter is we need to be transparent in our organization. We need to communicate down to the physician level and down to the staff level so that they know what we're doing, what we're trying to do, and how we can effectively put these into place, and what are our success factors, what are our challenges, and how do we overcome those. And again, the blending of data is something that really is critical in order to be able to do that. So that's what I want to see from a management side, is to have all of these metrics in one place that I can communicate out effectively, and I want to make sure that they're accurate and that I'm getting them when I need to see them. So from a management perspective, that's great. So from a technical side, which you are, Russ, what problems did I just drop into your lap?
Oh boy, quite a few. So, some of the challenges with modeling and reporting on patient access data, and really what we're talking about here is the patient experience. Let's start with some of the obvious ones. Various applications that do scheduling, there's no standards for how to set up a schedule, modules, templates, and certainly the data and the inputs, they vary quite widely across the major systems used by practices and health systems and hospitals. Getting the key data out of the solution, just measuring available time versus book time. Oftentimes the reporting tools or the data extraction tools available from the applications don't pick up on this key data. Traditionally that's sort of been internal data to the application. It's not typically a reportable field, yet it's critical to measuring utilization. If you've ever worked with time in reports or dashboards or even in Excel, it's not simple math. You can't just roll up hours and minutes to get days, weeks, months, or sessions. So even the calculations behind the scenes that need to go on can be challenging. Matching denials, which may not occur until 2 months after the patient's been seen, and then trying to match them back to the actual patient visit and where we may have gotten bad information through a registration process can be a challenge. Figuring out what benchmarks to use, how to use benchmarks, how to integrate those benchmarks, aligning patient satisfaction, again, data timing issues with getting that data back to the actual visit, especially when a patient might have had multiple visits over a month, and yet the patient satisfaction data may not be available right away. And so we have a lot of different moving data points, and trying to line them all up from different data sources can really be a challenge if you've ever worked with this data. Let's start at the beginning, though. The first thing is to identify what are the data sources where we're going to pull data from. Scott, you mentioned wanting sort of appointment data and utilization data, looking at patient satisfaction, tying it in with registrations, denials, point of service collections, and then, of course, benchmarks and targets. Let's assume for now that's the data set we're going to work with. These data sets need to be staged, delivered through a relational database individually, and then can be joined collectively when we start to blend data to do our more complex data marts. That may sound easy, but again, if you've worked with this data, there's several challenges as we start to link the data through. So we're not going to be able to use the application that does the scheduling. We're going to have to work with a relational database, typically healthcare organizations using SQL Server or Oracle. We're going to need a strong set of programming ETL skills to transform the data. We're going to need a powerful BI tool to be able to slice and dice and deliver the analytics back to the users. And of course, we need good, what I call content experts, people that understand what we're trying to measure, they understand our organizational issues, and then can be able to put those all together into the dashboards and the reports. So let's assume, though, that we've been able to do that now, and we've delivered out just those sets of data marts. We'll start with these as an example. So let's jump into our analytics, and I'll just show you a very simple, we've built out now cubes. This is a very simple data set. I want to look at appointment counts. I want to look at bumped counts, and I want to look at our cancellation counts. Let's start and we'll look at these by department. I can just point and click and drag and drop. Maybe I want to start to see where we're having the most cancellations. I can just quickly sort on that. And then let's start to bring in and look at locations. And maybe we want to even look then by providers and start to see, we've had a lot of cancellations in one particular area, or maybe we want to filter and start looking through our different departments one step at a time. So we can quickly now point, click, drag and drop, start to filter, sort through our data, and then even drill all the way down to detail if we need to. So through our analytics, we've now staged out different data sets. The next step then is how do we start to line them up? Okay, and this is a visualization where we've run multiple data marts together. We've looked at scheduling utilization, we've looked at our appointment lag, we've looked at our total volume of appointments, our no-show rates, and our patient satisfaction. So taking the different data marts, linking them through, we can start to get to more visual dashboards or just better analysis where we can start to quickly look across. We can look at where we're seeing challenges. So Scott, let's assume from this perspective, I've put all those different data marts together, both staged individually so you can slice and dice through them, and then now we're able to blend them and even bring in benchmarks or targets. Where do we go from here?
Well, Russ, I want to say that I really appreciate, having the availability of the data, and that's, a key first step. And then, creating a report like you just did that makes it easy for me to look and see areas where we're performing well and areas where we're struggling is very helpful without having to digest a bunch of numbers and do a bunch of internal calculations either in my head or having to manipulate them on a spreadsheet or something like that. It's great to be able to have a quick view of what's going on in areas that demand immediate attention and areas that demand more strategic attention. But the fact of the matter is that data, while it's there, is just kind of that critical first step, and it's not really doing anything for us if we're not utilizing it in order to manage our business. And when we look at managing our business, utilizing the analytics, we can tell that usually areas where we're struggling fall into different categories. People always talk about system, process, people, or, you can break people down into staff and patients that do things a little bit differently to kind of add to the struggles that we have. But really, the first thing we need to do is heal ourselves. And one of the ways we do that is by looking at, the systems and processes that are out there. And what those really entail most of the time are a kind of a lack of standardization or a lack of policy within our organization, and that happens all the time. I think a perfect example would be something like visit types. And visit types, whenever we go in with a client to do a patient access initiative, they always say, we have too many visit types and it's difficult to manage. And, visit type really is a critical data element for a lot of different measures that you want to look at. And so it's difficult when you have, just a bunch of them out there. Now, you look at a report like this where it's by provider and you can see, okay, that doesn't look too difficult to see, but all of a sudden when you start bringing in all sorts of different providers, you can see everybody does things a little bit differently. And so you can see there's a bunch of new patient visit types that are out there. They range from, different descriptions to different durations, where one provider wants an hour for a new patient, another may only want a half an hour or 20 minutes. Return patient visits are even worse. And so when you see things like that, it makes it difficult to manage. The problem that you have is when people say, I need to get rid of visit types, that's something that's a lot more difficult to do than it really sounds like it should be or actually should be. There's a lot of political pressure involved to keep things in place the way that they are. One of the recommendations we make with clients when we go in to do that is you don't necessarily have to get rid of visit types. You can get effective reporting if you take those visit types and you categorize them. So if you bring in like an appointment visit type category, now all of a sudden you can see that what was 5 different visit types goes down to 1, or you can see what was maybe 600 visit types now goes down to about 20. And so really that categorization can help you get the power of reporting that you need to look at those different metrics by visit type, because you're looking at categories, but at the same time you don't have to go through all of the battling that you need to go to pare down the actual visit types within the system. So that's just one application that's out there. There's lots of other standards and processes that come into play with regard to how we utilize blocked time or held time or frozen time, things like that. And so you maybe want to take on a different dashboarding or reporting type philosophy where you look at something like, we're doing a good job of scheduling patients, but how are we doing with arriving the appointments that we're scheduling? What are our arrival rates? And when we're not arriving as effectively as we'd like to see, whose fault is that? Is it the patient's fault because they're canceling a lot, or is it our provider's fault because they're bumping a lot of appointments? Well, in this dashboard, it becomes very quick to see we're struggling a little bit with our bump rate, but we're doing fine with our cancellation rate. You can see that just by those trend indicators on the left-hand side, which allows you to, focus your efforts on what needs to be corrected moving forward so that we can get those arrival rates up to where we would like to see them. Another different dashboarding type philosophy that you might see would be one where you bring targets into play and you start looking at different metrics, and you can see, again, very quickly areas where we're doing okay with our same-day appointment ratios, or we're doing great with our patient balances collected at the time of service. But look just one over to the left and you can see our no-show rates really out of control. We've been above our target every single month for the last 12 months. And really, how's that no-show rate playing into other areas, like maybe our third next available rates, where our third next available lags could be a lot shorter if our no-shows were just canceling and opening up those appointment slots ahead of time, or if there's a way that we could double book a percentage of our no-show rate in order to drag down and find some additional capacity out there for to drag down our appointment lags overall. These are some of the different things that you can look at from a reporting standpoint that can help you really manage to the specific problems that are out there.
Scott, what I really like about this dashboard is by adding the context, whether it's an internal target or a benchmark, this little line, just where's good performance, because it can even be challenging that good, in the above volume graph here, right, good is above the line, but when we think about no-show rates, good is, we want low no-show rates. So it really guides the user and makes it very clear if you're hitting or missing, whether it's a benchmark or a target. I think it makes it very easy to follow.
Yeah, and again, these quick answers or, quick view dashboards, both from a management and a provider perspective, where they don't have to really dig into a lot of numbers, they can really just focus on areas of concern right away, is something that we've gotten a lot of good feedback from our clients on that are out there. And again, dashboarding at that level is something that really helps show what is truly going on in the organization. The problem that you have a lot of times is what the patients are feeling is a little bit different. And so you have to really kind of try to reconcile the two when you're out there. So when we're looking at something like scheduling, and I like to look, at appointment lags or third next available, and we talked about doing that at a visit type level and the categorization. When I'm looking at lags or I'm looking at, availability or timeliness of access, I actually kind of like to break it down into 3 different areas. I like to look at the emergency area, or I need to get in right away, as fast as I possibly can today or tomorrow, and if you can't get me in, then I'm going somewhere else. Otherwise, you can look at like a follow-up, which is kind of the opposite end of the spectrum. Let's say doctor wants to see me in 3 months, doctor wants to see me in 6 months, no hurry, just fit me in wherever you can along that timeline. And between those two, you have what I call the standard visit. This is one where the patient wants to get in probably as quickly as they could, but it's not an emergency situation. It's something where they've been told by their primary care physician they need to go see a specialist. They'd like to get in as a new patient, again, as quickly as they can, but they don't, necessarily need to be in the next day or two. And that's really what sets the tone for what really is going on in your organization, is when you look at those standard visits. When you look at those standard visits, a lot of times you can see here's where we're booked, where we have some utilization available, and then you can start looking at different demands. You can see from a session standpoint in the graph that's there there are areas where we know we could bring on more patients. How come we're not? Is that an internal issue where our providers don't have schedule at that time? Or is it that our patients just don't want to come in during that time, and do we need to make ourselves more available to meet their demand? Additionally, from a patient perception standpoint, how easy is it for them to make an appointment? Do they have to wade through a bunch of stuff? Can they do it easily online, or do you have processes in place like frozen slots or different little insider tricks that they have to, hoops that they have to jump through to get through in a timely fashion that really their best bet is to do it over the phone? That's what's really going to come into play with how your patients are perceiving these things. And once you understand what your patients are perceiving, it's really critical to go in and look at dashboards at a micro level. I want to get down to the provider level. So, Russ, can you maybe show us some provider dashboarding ideas that are out there?
Sure, Scott. So when we talk about providers and specifically physicians, typically I find they fall into two categories. There's the, I need a quick glance. I need to be able to see very quickly and visually what's going on with canceled or no-show rates. And here's an example of a visual dashboard that is also interactive. Security could pick up, automatically identify the physician with a simple click. They could see where their appointment lags are. They can see where they're busiest in their schedules, or see the bulk of types of appointments that they're running. And even through the interactive, I could click on sort of Medicare visits and quickly see that I'm doing the bulk of them on Mondays, and that's probably because of how we're scheduling out. You could also see Medicare visits. We've got some cancellation rates going on. So very simple interactive type dashboard. The other type of dashboard we find physicians tend to like is what I call encyclopedias that trend months, but all the visualization tools now, with a simple click, you can get to the detail behind them. So you really can satisfy physicians in particular with what they want to see and how they want to see it. This is another style of dashboard. A lot of organizations we have, they would email these out so they can show right up in an email. Could be opened up on a mobile phone, or they could also be delivered through the web. This is a style, one of our templates we call the KPI, and it's really meant to give 3 time point comparisons, something we didn't see on that other dashboard, where we can see the 6-month average across our different metrics, their next available, appointment lag, no-show rates, both arrived and scheduling utilization, and then we're bringing in that all-important patient satisfaction metric. We can quickly see trends of how we've done in the last 6 months versus last month versus the current month, and fairly easy to see that we're, improving on our scheduling utilization, and we maybe had a little dip in our patient sat last month, but now we're moving to, better scores this month. So Scott, it's easy to take metrics, if we've staged them, deliver them to physicians and kind of focus them. How do we take it up to the departments and look across the physicians and the providers and start to look for opportunities and gaps?
As you look at dashboards at more of a macro level then, as we roll these things up, there are kind of a couple of different philosophies out there with what you want to do. Sometimes people want to take 1 or 2 metrics that they know that they're struggling with and really get in depth with the trends and the indicators and interplay in those metrics. And so you can see a dashboard here which really delves into lags, something that you can look at and say what really is driving the difference between the day the patient requests an appointment and the day we actually get them in for an appointment. And you can look at averages, but you can also look at, what percentage are coming in the same day or within 3 days. And then you can look at what percentage are coming in greater than 30 days. And you can see there may be problem areas, or there may have been problem months that may have made those lags be a little bit higher than you would hope or expect them to be. In addition to that, you can look and see how maybe something like lag feeds into other problem areas that you may have, like cancellation or no-show rates. And so you can look and see in the graph below, or the chart below, that the probability of cancellation or the probability of no-show really increases dramatically as the lags get further and further out. So the more that you have same day or within 3 to 7 days, the probability of cancellation or no-show is significantly different than those that are greater than 28 or 30 days. So that's one way to look at it at a macro level.
Excellent, Scott. Going a little further, we can pick up and then start to visualize. So using our analytics and the visualization tools, we can blend those metrics, and this is really where the power of analytics and visualization come into play. So what you see here, we have a dashboard that is listing and rolling all the physicians up. We can then filter through different departments. We can look at the same metrics we showed to the physicians and at an analytical level and start to see which physicians have the least utilization, which physicians potentially are being overbooked. we can quickly isolate or highlight, where we're having lag gaps. Just by a simple click, all of the data points on my dashboard would change. And what's interesting is, why do we have physicians with low utilization, yet, these are all appointments that are taking a long time to get in, or we can isolate further where our third next available appointment is very high, and then quickly start to see which physicians where we might have issues. And so the question that we might want to address as we start to dig into this is, why is this physician have so many patients that aren't getting in quickly when they've got open access in their schedule, versus this physician that is fully booked, and maybe we need to think about shifting some patients over.
I really like things like this that, again, show and highlight the different areas that are out there. And sometimes from here, what I like to do is maybe even take it to another level, where when I see these outliers, I want to really kind of understand the impact or the cost that comes from this, that really everything that you do, there's a cost associated with it. And so what I like to use, or what we use at PDS, called our Performance Opportunity Dashboard. And what we're doing with this is we're really trying to take what we know is going on in the organization. We want to set a target or a benchmark against it, and then we want to ask ourselves, what if? What if we were performing at that level that we expect? Or what if we were performing, every provider was performing at the level of their peers? There's a certain cost or financial benefit that would come from that if it's there, but what you can look at it as is kind of a cost of doing business the way we're doing it. So this does two things. One, attaching a financial impact to the way that you're doing business is really a compelling argument to change the way that you're doing things. It can really help you kind of modify and put processes in place that are much more better and efficient. Additionally, it highlights outliers that are out there. If you look at that last column, you can see that there are really just a handful of providers that have the greatest financial opportunity out there without having to put some widespread policy in place. There are just maybe a couple of providers that you can work with in order to realize 80% of the return for only 20% of the work. With that, we just talked a little bit about benchmarks that are in there, and what I'd like to do, this would be really helpful for us, is I'd like to know which benchmarks you typically utilize in your reporting or dashboarding up there. So Russ, if you could bring up that survey. Looks like a lot of Press Ganey out there, which obviously is, the market leader for patient satisfaction surveys. Lots of others, and so, if you could chat in what you're using as sources, we'd really appreciate that, because we're always asked what are great sources for benchmarks out there. And then a lot are using MDMA as well.
Yeah, two people have chatted in. One organization is using MapAP, which is, I guess, HFMA, which I'm going to show a little bit of what we're doing with HFMA. Somebody else chatted in, currently using Patient Access Symposium benchmarks, two other data sources that were shared with the other. So HFMA was actually one of the choices that I had on the other screen there. And this is an example of a dashboard that we've used and put together as one way to look at different data points. This is with data from HFMA, their map keys as it's called. And if you look across, these are from the physician practice, the practice management map keys. The first two metrics that we've highlighted in this dashboard are both, percent of patient schedule occupied, and then point of service collection rate. And so you can see the HFMA map key percentage, the goal, which we might have internally to our organization, and our actual results. So it makes it very easy. These dashboards are really designed to be shared out to kind of give transparency across the organization or within a particular department as to how we're performing against, external benchmarks. Here's another page where we're using that same context. We call this Quick Answers, where you can see across the HFMA map keys the performance line, and then are we hitting the target or missing the target, similar to what Scott explained earlier. Another organization that we've recently become more involved in is the National Association of Healthcare Access Managers, and they also have, they call them access keys, and they provide 3 different levels of access keys: good, better, best. Their access keys are also available online, just like HFMA's. So if you're looking for some other benchmarks, you should be able to get hold of these fairly easily. And you'll see them measuring a number of different metrics that we've talked about, whether it's insurance verification or collections at time of service. And again, you can measure your own organization and making dashboards that are very easy to follow and transparent.
So this is a great dashboard, Russ, and as I look at it, I can see a couple of measures that are there that we haven't really talked a lot about, but I know that are pretty critical to patient access, and that's patient collections at the time of service, and then insurance verification because of the issues it may cause us. So Let's talk a little bit about patient collections. This is something that actually is difficult, and it's funny how when I was managing clinics, a lot of the resistance I'd get from staff to do this. Point of service a lot of times can be point of crisis is what I've heard, particularly in an ER, an urgent care center. You have a patient in pain, you have a patient sick or uncomfortable, and it's not the best time to ask them for money. The problems you have is when you don't get it there are a lot of additional costs, and the probability of collection actually goes way down. So the key to this is really communicating the expectation to our patients. And patients are starting to get used to this more and more. And as they become more and more familiar with how high deductible plans work and health savings accounts and the availability of funds in those, this is something that we can get better and better at. Again, the key is communication, and then also while we have the patients there and while we have the patients engaged, can we collect outstanding balances? This is something that, there can be a lot of success because, again, they may have had an appointment a long time ago that they didn't pay for, but now they have more money in their HSA that's been accumulating over time when they can do this. It leads to a lot more success as long as we're communicating effectively and we're letting the patients know that that expectation is there. When we look at something then like registration can be a huge area of frustration for our patients. Now, with the Affordable Care Act and the insurance markets and, with pending legislation that's coming down as well, patients really are changing insurance plans pretty frequently. And so that's why it's absolutely critical to make sure that we have the most accurate insurance information every single time they come to see us. I don't care if they were here a month ago. I don't care if they were here 3 months ago. We need to make sure that we're updating that insurance information and that it actually is getting into the system. Because a lot of what we hear from patients out there is that it's extremely frustrating for them that they know they gave the right information, but it still got billed to the wrong insurance, and now they're getting threatened to be sent to collections and having to spend a lot of time trying to fix the situation that really could have been fixed in minutes at the point of service. The problem is, how do we really check how well we're doing with registration? Well, it may take a while, but we can look at it from a denial standpoint. If we're not collecting the correct information, then we're going to get denied for that for insurance purposes, eligibility, authorization, those types of denials that are out there. And the problem that you have from that is twofold. One, there's a significant cost to having to rework a claim multiple times and to resubmit it to the correct insurer after finding out who that's supposed to be. But in addition to that, it really impacts the cash flow because you go from something that should have been paid in less than 30 days to something that's taking 90 to 120 days to get payment for, when we could have just collected the information correctly the first time and you wouldn't be there. So we need to make sure that we're communicating that way and that we're looking again for outliers. Are there specific clinics that are leading to the problem, or is it an organizational problem overall which may require a change in policy rather than a simple training issue if it's just a handful of different locations? So one more time, I would like to ask for a survey as we move forward. I know there's a lot of information out there that we really need to know, and so I'd like to know how well you guys rate your ability, your analytical capabilities regarding patient access reporting. So if you could just take a second and let us know there. It looks like most of the people, or about half the people, are satisfied with what they do, but they do notice some gaps that are in there. Most of the others think they're pretty strong or even outstanding with how their tools are working, which is great to see, because this data really is key in order to enhance what you need to be doing for the benefit of both yourselves as well as for your patients. So with that, let's talk about having all of this data at our fingertips. It really is great, but again, like I said before, it's not worth anything if we're not using it to drive change, if we're not using it to manage our business. And really, anytime you try to change something, you're going to get resistance. You're going to get people who tell you, there's really nothing we can do. Our physicians won't let us change. I don't have enough staff. I don't have enough time. It's our patient's fault, or it's turnover's fault. A lot of these things happen, and you have to overcome that resistance. I think one compelling way to look at that is to let them know, okay, we can keep doing things the way that we're doing, but just so you know, our payers are starting to measure us according to these different quality initiatives that are out there. And there's an example of a payer dashboard that's out there showing the quality measures that payers are measuring right now. If you could bring that dashboard up for us. Patient satisfaction is a measure that payers are using to measure providers right now because they need to make sure that their subscribers are satisfied with the networks that they're providing. So they're going to measure you on quality, they're going to measure you on patient satisfaction, and they're going to measure you on overall patient experience and making sure that you're doing the right thing for by their subscribers. So if we want to look then at managing this change overall in order to really move the trend, it really requires getting buy-in, and buy-in from your staff as well as buy-in from your providers. And from a staff standpoint, it's making sure that they're ready for transparency. It's making sure that they have the skills and abilities and information to be able to communicate effectively with the patients. And then you need to look at balancing what's good for your particular business versus what's good for the patient, and making sure that you're providing the things that the patient needs and demands while also making sure that you're operating your business in the most efficient manner possible. From a provider standpoint, a lot of times that may be difficult to get the engagement, but a lot of things we're seeing our clients do right now is aligning the incentives that are coming forth by more quality-based payer contracts with their compensation as a whole. So if you see this example of a report for provider compensation, you can see that, obviously productivity and volume collections are always going to be, critical measures that feed into a provider's compensation. But you can also look and say that, create an incentive pool with quality scores and access scores. And then you can also look at what's the provider's role in helping the clinic or organization itself reach their goals and incentivize them that way. And providing providers timely information that allows them to feel like they're managing their overall compensation is something that can help drive their behavior, drive the way that they do things, but in addition help them to be satisfied with what they're doing for the overall good of the organization. Can be definitely a very effective way of doing things. The fact of the matter is we have a lot of information at our fingertips, and it's telling us what's going on in our organization. We even have some patient satisfaction measures that are out there that we think we may be able to pinpoint to certain issues. But at the end of the day, it doesn't even matter what we think. The patient's perception of our organization, the care that they receive, it's not excellent unless the patient thinks it's excellent. And so what we really need to do is drive to do the right thing by the patient. We need to make sure that we're taking their experience into account in everything that we're doing. We need to do it because it's a competitive environment, and if we don't, we'll lose it. We need to do it because they're taking on more financial burden and won't be satisfied with poor experiences. But most of all, we need to do it because it's the right thing to do. So with that, thank you, Russell.
With that, Scott, thanks for guiding us through this today. To our PDS customers, thank you for being a customer. For those who have joined us, we hope to talk to you to see if we might be able to help you with any of these challenges or any other the analytical challenges that you might be having. So thank you very much for joining us. We hope to see you again at a future webinar.